Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to use a TENS unit or EMS unit. We'll explain the difference between the two to relieve muscle and joint pain. And we have a new machine here. It's called the new iRelieve 880.
Okay.
It's one of their new machines, and we're going to explain to you why it's kind of exciting.
Actually, it's 8080-8080.
All right, what did I say? 880?
880,
Yeah.
but it's close.
He's correct. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. You're also going to want to go to the Facebook and like us because tomorrow night we are giving away something again for free.
Right.
So
if you give it away, it has to be free.
That's what I was just going to say. If you give it away, it is going to be free.
We could throw a kink in there, but we won't.
That's right. So come to us. All right, so why a TENS unit? Why would you use a TENS unit? And this is kind of exciting too, Brad, because they just came out with a report, and we're going to go over this.
Sure.
I'm going to go over this report next week because the details of it are really quite interesting.
Okay.
So these are a bunch of Australian doctors, a bunch of general practitioners that got together,
right,
and they were telling you what you should do and shouldn't try for knee arthritis and hip arthritis.
Oh, two biggies.
Yeah, and there's really a lot of things that are surprising of what you shouldn't do, and one of them is surgery. I'm going to give that away.
You should
not do surgery on like a meniscus tear unless it's locking up.
Okay.
So, or let's say just your knee pain starts cropping up for no reason, and maybe you're getting older and the knee cartilage is starting to go on. Unless you're going to go to a knee replacement, but just for arthroscopic surgery,
right?
Nope, no surgery unless it's actually locking up. But they do recommend trial of a TENS unit.
Okay.
So the studies are showing there may be some benefit from using a TENS unit. So this fits right in with what we're talking about today.
That, but we know that benefits with TENS units for particularly chronic pain, where people are using synthetic opioids, which can be is a major problem, at least in the United States. If you can get off of those and manage your pain with a TENS unit, there are no side effects.
That's right. There's no downside to using it. There's a couple instances in which you shouldn't use it, and the booklet goes over that.
Right.
So again, the 880 unit, this is by iRelieve. I want to do, this by the way was cleared by the FDA.
Okay.
So we always want to make sure that's true. I want to just tell real briefly why I picked iRelieve. I wanted to pick a TENS unit that I thought was a good unit. So I went onto the internet and I was looking for the one with the best reviews.
Sure.
And iRelieve was the one. And now, since we did a video on it, iRelieve, the company, contacted us and said, hey, we're coming out with some new products.
Right.
I said, that's cool. Let's take a look at them. And so they came out with this one. And the biggest advantage of this one, by the way, what is TENS unit? What does TENS stand for?
Transcutaneous
electrical nerve stimulation, or neuromuscular stimulation.
Neuromuscular. It's a mouthful.
So, yeah. And I'm just going to point out one of the big advantages of this unit is it doesn't have batteries. You can recharge it.
Right.
Brad and I have been around for 150 years. And so we saw when the TENS units first came out, and oh my God.
You always had to change the batteries.
The pads were so much harder to use. Remember, you had to tape them in place.
Right, yeah. I mean, yeah.
You had to put gel down.
Now you're going back, Bob.
Yeah, and
dating us.
And those units were thousands of dollars.
Yeah.
And this one is $129.95. I mean, that's just hard to believe.
Yeah, and that includes the wires and the pads and
yeah, it includes the two leads. It's got smaller pads. I know I'm jumping around a little bit here. We've got smaller pads, and we got the larger pads.
Right.
I've got the smaller pads on, and Brad's hooked up to one of the larger ones. And they show the different ways where you can put it on the different parts of your body to help different types of pain.
Right.
So let's just show real quickly, Brad, with my diagram here. I'm really proud of this.
Yeah, you are an artist, Bob. If this doesn't go well for us, we're going to get it. You can get into the art field, and I'll get into the singing.
Yeah.
That's killing
So
me.
basically, let's say you hit your thumb. What happens is the thumb, through the neural pathways, sends the message of pain right up into your brain. You're going, oh, that hurts.
Right.
So what happens with the TENS unit, it actually stimulates some smaller nerves that cuts off the pain pathway right here. Let's say we have it hooked up right here, or we could have it hooked up right here.
This is that gate.
This is the gating theory or a gate theory. It's cutting off the pain pathway. And what happens then?
Yeah, look at that. Get rid of that smile. Turn your frown upside down. There we go.
And he's smiling because the pain has gone away. The other thing it does, it actually stimulates the natural opioids
Sure.
in your body, the endorphins,
Right.
the endogenous opioids.
Well, you've been doing your homework,
I've been
Bob.
doing my homework, so that also puts a smile on you. So
And isn't that true? Even after you turn this off, those continue to
very good
actively
point.
work as a pain control.
Which, by the way, there is a point of contention here. They recommend, and they have the timer on this. This has a timer. It can go up to 60 minutes, and they recommend not to, do more than 60 minutes at a time.
Sure.
But I mean, I was taught, and I just read it recently, that you could keep it on all day.
Okay.
So I think Brad and I kind of discussed it, where you said, well, you could put it on for 60 minutes, take it off for a while, and then do another 60 minutes.
Right.
So that would work out really good.
So things change and evolve and grow over time, and I think this may be just another one in regards to TENS units.
So in setting this thing up, by the way, it's got a nice little clip on there that you can clip onto your belt, and you can put it in your pocket.
Sure.
So it's got the 2 leads, and then it's got the front panel here, and it's got the screen, which I guess they've made that bigger too.
Yeah.
And
So as
and
you
it
get
lights up.
older, you can.
Yeah.
Yeah, the vision thing.
When the peepers are going out, you got to be able to make sure that you can see things. So rather than try to show you on the machine how to run this, I actually drew a picture here. So this part here is the bottom part of the unit, and this part here is what you'll see on the screen.
Sure.
Okay. So can I have the unit first, Brad?
Yeah,
I'll disconnect you. So I'm going to go ahead. So there's basically 2 holes on the top here. That's where the leads go in. This one's channel 1 on the left side,
Right.
and the one on the right is channel 2. So I'm going to go ahead and hook up channel 1.
You just simply push it in the socket. It's easy.
What I would recommend, by the way, I would put the pad in place, and a lot of times you want to maybe use soap and water, and you want to make sure there's no hair there.
Right.
But you're going to clean it off, and then I put the pads in place, attach the leads, and then go ahead and attach the lead to the machine. Because if you try to put the pads and then try to attach the leads afterwards, it gets really difficult to do. I hope I'm clear as mud on that one.
Yeah.
So-
So this is obviously, you've identified where you want to put the leads, and Bob's jumped, we kind of went over that.
I just did it here because it's an easy place to show. But,
Sure.
but I could do a tennis elbow here.
Right.
Or that'd be golfer's elbow here on
Sure.
the inside here. So.
Right.
All right, so the first thing I'm doing, here's the control buttons below. I'm going to push on the on button. So you want to show me where the on button is, Brad?
Oh, right there.
Yeah.
Plus.
Okay.
Plus or
You
on.
hold it down for like 3 seconds, and when that happens, you're going to get this screen right here. And it's going to say program, intensity, minutes, and it's going to have one of these, one or the other of these. Right now, mine says TENS unit. So if I push mode, which I do right now, this TENS unit starts flashing, and if I push on or off, it'll either toggle to the EMS or back to the TENS unit
Sure.
again. So right now, I've got TENS unit. I'm going to leave it on the TENS unit. The EMS is gone here. We'll talk about the EMS in just a little bit.
Sure.
So the next time, I'm going to go ahead and push mode again. Okay, and when I push mode again, now program is flashing.
Right.
And I'm going to pick 1 through 6 of the TENS units. And it's just real. Oh, no, I'm sorry. There's 1 through 8.
Right.
There's 8 different modes for TENS.
I was going to correct you on that, Bob.
Oh, thank you.
I'm right on the ball.
1 through 7 is for pain relief.
Okay.
They're just different modes. I found basically 1 was a little bit, easier on me than number 7.
It's more of a constant,
Yeah.
consistent buzz kind of a feeling.
Right. And number 8 was that was like, remember what low TENS was, where it was kind of that sharp burst of pain?
Yeah. So these are things that you kind of play with and get a feel for this.
Yeah, so I would probably start maybe on number 1, P1, if I were you. And then I'm going to hit mode again, and that locks it in. So now it's going to then go down to minutes. And the same thing, you can set the minutes between 1 and 20, or 1 and 60, I believe. Let me see. Yeah, it'll go all the way up to 60.
Sure. So yeah, 1 minute, 2. Typically, 20 is a good way
I
to
take
start.
that back. It goes 5, 10, 15. I think it goes in 5-minute increments.
Okay.
So I hit mode again, and now I'm ready to go. So now I'm going to hit channel 1. I hit channel 1, and I'm going to go ahead and turn my intensity up. And now what I'm going to recommend on this, and Brad and I just experienced this, you push 1 and you wait a little bit because it has to go through the whole cycle before you feel it.
And that cycle may take between 5 and 10 seconds.
Yeah, so I don't really feel much on that now, so I'll go to 2. Again, I'm on a lower set. Oh, now I'm starting to feel it.
Right. Usually you start to feel a little tingly sensation.
Yeah.
So 2 is just the intensity we're talking about, not the program.
Yep, so I'm hitting number 1 here. Now you can see how my finger curled up there? That actually is, I'm not doing that, the machine is doing that.
But you can clearly feel it.
Yeah, this is comfortable. This isn't something that I would be uncomfortable.
Right.
So now as I go up to 6, 7, now you see how it's, whoa.
Right. So
that would not be comfortable.
This is one thing we didn't really explain. When you get the sensation from the TENS unit, also what goes along with that with the human body is muscles contract as a response to electrical current going through your body. This is a very small amount of current, but it's enough to get the muscles to contract. So you're going to not put the current so high that you get a strong contraction, unless, if you were trying some other goals,
right,
which we'll get into in another video, you might do that in those situations, but not.
You want to turn yours up, Brad? It's on
right.
channel 2 now.
So here we got channel. Now this, you would not normally use two people for
right.
our demonstration because we don't have
the
any
bigger
other
pad.
Right.
You probably can't see it, can you?
So here, I actually have a wound today. I got a little pain from this little rug rash. I got mountain biking.
And you would not put this over a wound, by the way.
Always on healthy skin. So I've got it above there. And you're all set with me here, Bob?
Yep.
Channel
2.
two.
So I hit channel 2 on the button there on the panel, and now Brad's going up, and he's working his way up, and he's going to feel. What number are you at? Oh, you went up to 7 last time. I won't go any higher than that.
Well.
Oh, you're on channel 1.
Right. I was playing with it, Bob.
Well, no, you're hitting mine.
Yeah. Turn it up on him and try to do.
Thanks a lot. All right, I want to put yours up.
Oh, there we go.
There we go.
So,
take that, Brad.
You can go a little more. Woo, there we go. And that's not uncomfortable though, but although it is stimulating, you can see.
Yeah. Which brings us to the second setting. So you can actually go to toggle. I almost dropped it.
Oh, Bob.
Here, you hold it. Don't turn
relax.
it up. And you toggle it and you go to EMS, and that's electrical muscle stimulation. We're kind of running out of time here, but that's to strengthen weaker muscles as long as your peripheral nervous system is intact yet. Like if you had a stroke or a spinal cord injury, multiple sclerosis, cerebral palsy, even healthy people, you can actually stimulate the muscles. So it does both. It does TENS unit and
right.
So.
Do we want to mention the precautions as far as?
They've got a whole book full of precautions, and the big one we always worry about is a pacemaker and pregnant women, and don't put it over the carotid sinuses, and don't put it over your eyes.
Right.
So, all right, we're taking way too long here. Thanks for watching, everyone.